This is episode 1. In this episode, I will discuss the recent results of an industry-funded, randomized, double-blind, placebo-controlled crossover trial comparing Solriamfetol to placebo in treating residual excessive daytime sleepiness and cognitive function in patients with treated obstructive sleep apnea published in Chest. Residual excessive daytime sleepiness despite adequate treatment of obstructive sleep apnea is common in patients with obstructive sleep apnea. Treatments for residual excessive daytime sleepiness despite obstructive sleep apnea treatment include modafinil, armodafinil, solriamfetol. This study was conducted from May 2021 to September 2022 at 28 sites in North America and Europe. The participants were 18 to 65 years old, diagnosed with obstructive sleep apnea and impaired cognitive function, despite as an age-corrected scaled score of less than or equal to 8 at the screening on the digit symbol substitution test, and a score of less than or equal to 9 on the British Columbia Cognitive Complaints Inventory at screening and baseline. Participants were included if they were consistent in the number of hours of PAP use on greater than or equal to 5 nights per week, or greater than or equal to 1 month prior to baseline, or had no current PAP therapy for greater or equal to 1 month prior to baseline, but a history of attempted PAP use for greater than or equal to 1 month, or with greater than or equal to 1 adjustment intended to optimize therapy, or had a history of surgical intervention intended to treat obstructive sleep apnea symptoms. The participants were excluded if their usual bedtime was later than 1 a.m., they were a shift worker, they use of over-the-counter or prescription medications that could affect excessive daytime sleepiness, any contraindication for solriamfetol, use of PAP machine without downloadable adherence data, diagnosis of a sleep disorder other than obstructive sleep apnea, positive urine drug screen during the study, excessive caffeine use, greater than 600 milligrams per day, 1 week prior to screening or anticipated during the study, and history or current diagnosis of any clinically relevant medical, behavioral, or psychiatric disorder associated with impaired cognitive function. In this study, researchers randomized 59 patients to receive either placebo or solriamfetol 75 milligrams per day for 3 days, then 150 milligrams per day for 2 weeks. After a 1-week washout period, participants crossed over to receive the opposite intervention for 2 weeks. They measured the digit symbol substitution test, the British Columbia Cognitive Complaints Inventory, the Patient Global Impression of Severity, and the Epworth Sleepiness Scale. The primary endpoint was change from baseline in average post-dose digit symbol substitution test. Secondary endpoints were changes from baseline in the digit symbol substitution test, the British Columbia Cognitive Complaints Inventory, the Patient Global Impression of Severity, and the Epworth Sleepiness Scale scores at 2, 4, 6, and 8 hours post-dose. Solriamfetol was shown to significantly improve post-dose average digit symbol substitution test scores compared to placebo, p equals 0.009. When evaluated at each 2-hour time point, cognitive function was significantly improved at 2, 6, and 8 hours after dosing, all p-values less than 0.05. During solriamfetol treatment, there were significant improvements in the British Columbia Cognitive Complaints Inventory, Patient Global Impression of Severity, and Epworth Sleepiness Scale compared with placebo. The most common treatment emergent adverse events were nausea at 7% and anxiety of 3%. The researchers' conclusions were solriamfetol can improve objective and subjective measures of cognitive function in patients with cognitive impairment associated with obstructive sleep apnea and excessive daytime sleepiness. Limitations of the study include its industry funding by the companies who own the rights to market Solriamfetol. The authors list other limitations to include the 5-week duration of the study, which precludes conclusions regarding the sustained effects on cognitive function over longer durations. Overall, I believe this study adds to the literature for treatment options for patients with residual excessive daytime sleepiness and cognitive impairments in patients with treated obstructive sleep apnea.